do you have any tips for physicians to use telehealth effectively?
Sure. I think the utilizing a staff member to help you in terms of a technology check-in, that could be really helpful. I got some comments from some of the administrators who the patients are saying, what's a browser? And what does scroll down mean? And that may be an anomaly. It depends on what your patient demographic is. But I think making sure that the patient is aware of how the visit's going to occur, what to expect, just like they would, they've come to understand what they would expect in a clinic visit in person, and helping educate the patients in as much in advance. I think that will help the providers maximize their time with the patient and focus on the clinical aspects of care rather than the logistics. So I think anything that you can do in terms of increasing communication and transparency with the patients about what's going to occur in the visit. There's obviously been questions from patients around co-payments or co-insurance responsibilities. So helping educate patients on those things, and they vary, of course, depending on what insurance the patient has. But the more transparent you can be, more upfront, from the moment the patient is called to schedule the appointment, the information on your website, any information you're sending to the patient, using patient portals, using those different types of models to deliver some of the communication to the patients, in addition to the actual video and phone visit itself, will be very helpful. The other thing to think about is how you integrate the actual telehealth appointments into your daily or weekly schedule. And so it may make sense for the providers to use telehealth as kind of fillers when they have appointment slots that don't get filled for other reasons, or patients that cancel. This may be an opportunity where the patient wouldn't have been able to drive into the clinic in time to fill that appointment slot, but they would be able to do a video visit. And so trying to think about whether or not as a physician you're comfortable having those intermixed throughout your day with your in-person visits, or if you want to try to perhaps kind of batch those video visits at the beginning, end of the day, or a half day week, or whatever you want to do, just to really kind of maximize your own efficiency, and also try to be as consistent and on time as possible with the patient. So I think that's the other thing with video visits, is that you don't have your staff members in front of the patient saying, Dr. Jones got held up with a complicated patient, he's going to be a few more minutes. And so, really trying to be respectful of the patient's time and staying on track is a little bit more challenging if you're intermixing them with in-office visits, but that may be the best thing to do from overall efficiency perspective. So thinking through that, I think, is really, really key, and also how your staff members are going to help you with that process.